Good morning, medical students, junior and senior interns. My name is Dr. Benjamin Balmores Jr. I'm one of 20 anesthetic consultants together with 14 resident trainees in the department. We would like to welcome you to the Department of Anesthesiology. We're going to present to you a video series of lectures that will focus primarily on things that we feel that are relevant to a general practitioner, namely mass ventilation and intubation, the different types of anesthetics that we use for our patients, post-operative management in the recovery area, and much more. But today, we're going to focus primarily on mass ventilation because we feel this is an important skill that all doctors should be familiar with. So we'll touch on the different tools that we use, the different equipments that you use to do a mass ventilation. We'll show and demonstrate the proper technique to mass ventilate a patient, and we'll show you the different adjuncts we use to help us in managing the airway of our patients. So if you follow me next door, we'll start as soon as possible. Thank you. All right, so we're here in our office. Right before me are the different tools that we use to mask ventilate our patients. So we'll start off with the face mask. So this is the face mask. This is an adult-sized face mask. This is the nasal area. It goes to the bridge of the patient, nasal bridge of the patient. This is the mandible area. Goes to this part of the patient's face. Okay, it's clear, single use. It's very effective. This is a smaller size for a smaller sized patient. You can use this for pediatrics as well. We have smaller sized face masks for babies and all that. Okay, so that's one. So when we put patients to sleep, we give induction agents. Muscles in the airway relaxes, and sometimes the tongue falls back and obstructs the airway. That becomes very difficult to ventilate patients. So we use adjuncts, what we call adjuncts. I've got here two. This is an oropharyngeal airway. By the name itself, it goes to the patient's mouth and to the back of the pharyngeal area. So it's supposed to lift the tongue up. So it's supposed to lift the tongue up, and oxygen can go through here to the patient's lungs. Okay, this one is the oral airway or the oropharyngeal airway. Next is another option. It's the nasopharyngeal airway. So it's longer because it starts from the nasal area of the patient all the way to the back, the pharyngeal area. And the tongue sits on top of this one. So air goes here, through here, all the way there. So you might want to ask which one to use. You could use either this one or this one. But this is the most common tool that we use, adjunct that we use in the operating theaters.
It's worth mentioning the advantage of using a nasopharyngeal airway. You can use a nasopharyngeal airway even in an awake patient because it's more comfortable, but the disadvantage is you can traumatize the nasal passages and cause bleeding. The advantage of the oral airway, it's more available, it's easy to insert. The disadvantage is when you insert it in a lightly sedated patient, there's potential for stimulation of the gag reflex and potential for the patient to vomit and cause problems later on. And yeah.
This one is what we call a supraglottic airway, specifically a laryngeal mask airway. We use this for general anesthesia as well, and to alleviate obstruction during induction and anesthesia. This is very effective, single use, comes in different sizes as well. This is a size 4 laryngeal mask airway. An ambu bag, this is very common all throughout the hospital. We have this in theaters as well in the recovery. This is very helpful to give oxygen to your patient. Comes with a tubing. This attaches to a oxygen tank or a wall oxygen. So what you use this for is to connect this to your patient's mask and bag your patient. I think you need to be familiar with this tool because chances are this is what you're going to see in the ward. So the next session would we would demonstrate how in a mannequin how to properly hold the mask, and bag the patient, and provide oxygenation to the patient. So if you have any questions, just let me know. We will be happy to answer any of your questions. So see you in the next session. So this is the mannequin that we're going to use to demonstrate the EC grip. Again, just to review, this is the face mask and this is the nasal part, which goes here to this part. The round part, this one, goes to the mandible, this one. And the C of the EC grip goes here. The E of the EC grip goes to the patient's mandible here. So you press down, this one goes up. You lift the chin up, you lift the mandible up. So you're actually trying to simulate the sniffing position. So to demonstrate, again, the C grip, the E grip to the mandible. The nasal part, the mandible part, and this is how we put the mask on the patient. The ambu bag goes through here. And then you push the C grip down, the E grip up, and then you bag. Then you bag. So make sure that there are no leaks around the mask. If there are, then you might need to shift to the two-hand grip technique, just like this, and ask your colleague to bag for you.
So before we proceed with the actual demonstration, I'd like to discuss a bit about appropriate sizing for your oral and nasopharyngeal airway. For your oral airway, you measure from the midpoint of the incisors all the way to the angle of the mandible. For your nasopharyngeal airway, you measure from the tip of the nose all the way to the patient's earlobe. So now we proceed with the actual demonstration of insertion.
So I'm going to demonstrate the proper way of inserting a nasopharyngeal airway. So you need an appropriately sized nasal airway. Lubricate with KY jelly. Take note of the curve. Follow the curve of the nasal airway and gently insert the patient's nose. So I'm going to demonstrate how to properly insert an oral airway, an oropharyngeal airway. So you need an appropriately sized oral airway. You start off with the tip, this tip, facing cephalad, going through here, and then twist. So the tip now faces caudad, and then insert. We are done with our first video lecture. I hope it was very inspiring for you and you found it very helpful. So we'll just summarize everything we've learned so far. We showed you the different tools that we use, the different masks, face masks, both for adult and pediatric patients. We showed you our adjuncts, the adjuncts we use, the nasopharyngeal airway or the nasal airway, the oropharyngeal airway or the oral airway. And we briefly discussed about a supraglottic device that I showed you, the laryngeal mask airway. And the important thing is the ambu bag. You should be familiar with this type of ambu bag because this is available throughout the hospital. So I hope you found this video series helpful. Again, if you need to ask more questions or need to practice more, just feel free to ask us. So we'll see you in the next session, and thank you very much.